Morton's Neuroma is a benign thickening of a nerve in the forefoot. It causes sharp, burning, aching pains in the forefoot. Up until 2009 in the UK, there'd been no alternative to risky surgical removal of the nerve. After successfully completing cryosurgical training in the United States, Robin Weaver of the Barn Clinic introduced cryosurgery to the UK in 2009. Cryosurgery offers a low-risk alternative to surgery and has a much faster recovery time than conventional surgery. Mr. Weaver is the most experienced practitioner of cryosurgery in the UK, and as such, sees patients from all parts of the UK, as well as from abroad. Today, Mr. Weaver is revisiting one of his first patients to receive cryosurgery to see how he's getting on nearly 5 years later, and to hear why he chose cryosurgery over conventional surgery.
So Mr. Bennett, how long have you been involved in the world of dance for?
Probably a little bit too long really. I started when I was 12 and I used to compete and demonstrate with my wife, and then we travelled around the world teaching, lecturing, and that's when we decided to open a dance school. I've been professionals now for 38 years, and we opened the dance school, and then 33 years ago, and then what we did, we started teaching from babies. We teach all varieties of dance, all stages of dance, from children all the way up to top professionals who travel into the country to see us for their lessons also.
Would you mind telling me about the problems that you were having with your foot back in 2009?
Well, what it was, I was teaching various days, and I thought it was just a pain that was through teaching too many hours some days. And eventually, after quite a few days, the pain grew and grew, and it was like a shooting pain in between on the ball of the foot. And to walk downstairs was so painful, and I thought, I've got to have something done about this, because it was getting worse. And I left it for about 10 days, but some of my lessons actually were doctors, and I was explaining to them. They said, well, it could be anything really, from dropped arches to all sorts of things that are causing it. And one of my lessons, he recommended yourself to go to have it checked out, because that is my profession, and obviously I can't afford not to have my profession given the best I can in it, really. So, but it was just because of the pain as well, which was agonising, especially when you're teaching and just stepping off a step was unbelievable.
So why did you choose cryosurgery for the treatment of your Mortons neuroma over conventional surgery?
Well, what it was, I spoke to various people actually, and I mentioned it to various people, and they knew various people who had it done in the past. And I'm a little bit squeamish as well, and the thought of somebody messing about with my occupation, which could possibly lead me to being off, not working for many, many weeks. And I heard that it can be quite a nasty and sometimes not successful. And I thought that I need to go to somebody who really knows what they're doing and are professionals at it. And one of my lessons, as I say, was a doctor, said that you are the best that they recommended you to do this for me. So that's why I went along and booked an appointment with you on recommendation.
What can you remember about your cryosurgery?
Well, it was quite straightforward really. There was nothing, it wasn't like going into a doctor's surgery or anything like that. What it did, I went initially and had the scanner on it and see what the problem was. And obviously then it was what it was diagnosed as. And the recommendation was to have the surgery done in that way, because to me it sounded better than somebody cutting away at my feet, which could leave me on crutches for weeks and weeks, which I thought, well, I'll go for this easy operation of doing it.
What was the recovery period like after treatment?
Well, it's virtually straight away, actually. Within 3 or 4 days I was back doing what I do, with no side effects, nothing. I didn't have to sort of take it easy. I just sort of went straight back into what I'd done with teach, with no pain.
Would you recommend cryosurgery for other dancers?
Most certainly, because if it's their living and they can't afford to be off the floor, and it's like any profession, you need to be back at what you do, and it's a lot easier for them, most certainly.
From your perspective, how straightforward was the procedure itself?
Very, as far as I was concerned, because all I had was the injection into the foot, and then you explained the procedure all the way through to me, what you were going to do, about how the probe goes into the bottom of the foot and freezes the nerve, and then from there, that's how it works. And it was painless, it was no issue at all, straight off the bed, having it done, straight back into the car.
Did you have any pain the following day?
No, it was quite... I rested it for a few days, which you recommended, so just keep it steady for a few days, but after that, it's fine. Could walk with no... It was like a miracle cure, really, a little bit, as a dance teacher. And anybody who uses their profession, using their feet, or whether it be arms, or whatever it might be, this was, as far as the cure for me. It was very, very good.